The most common spots are the wisdom teeth.
The wisdom teeth are unique in that there are 4 circuits going through it instead of just 2. It's heart, small intestine, and the sympathetic and parasympathetic systems. And so you see people whose adrenal glands are not working, and it's because they have infection where their wisdom teeth were taken out, because you can have infections in the bone where your wisdom teeth were taken off for 50 years and essentially have no pain there, but it completely destroys your life.
That wisdom tooth, which is on the heart meridian, you see, was causing the problem.
If you can get a good, normal 3D cone beam x-ray of your jawbone, then you do have a much higher reassurance that you don't have this cavitation process going on inside the jawbone as well.
And if the dentist unroofs that and scoops that stuff out and then removes that ligament and then that heals, that patient can get well.
One of the questions that we get is, are there things I can do prior to my procedure to increase my ability to heal properly from a surgical procedure like a cavitation or from a root canal removal? One of the biggest things that you can do is to have proper nutrition, be eating a clean diet, be getting enough proteins and enough vitamins and minerals.
When that tooth comes out, you want to make sure that the socket is cleaned out really well. You want to remove the periodontal ligament. If there's infection, you want to get rid of the infection, and then you let it heal. I like to let the body fill it in with its own natural bone. How do you replace the tooth? Well, you have different options. Of course, an option is you don't replace it, you leave it alone. Another option is you can use something removable, which most people don't like. It's not very comfortable. The advantages and disadvantages, well, titanium, the problem is you're putting a metal into the bone.
Titanium itself is known as a hapten. It means the ions in the titanium itself can trigger autoimmune. So if you are genetically predisposed to something like Hashimoto's, celiacs, scleroderma, lupus, rheumatoid arthritis, it might get turned on, and even if that implant is removed, the trigger's already been pulled. So now you've got problems that you didn't have. Plus, I've got metal that is directly going into my meridian system. So it's like sticking a spoon in an electric socket and bending it around and sticking it in the bottom part, and it shorts out the whole meridian.
What we're finding is that many physicians that are referring their patients here, and also patients that are doing their own research, are desiring to have no metal in their mouth. They want to eliminate anything that could create a current, and that's why we now have Zirconia implants, which is, it's more like a ceramic. It's a complete non-metal implant that looks the same as a titanium implant and functions the same, but is considered much more biocompatible for the tissue and for the patient.